the really getting into a more receiving more specific information about technical assistance and operational research underway in the region. We'll start off with my colleague, Dr. Henry Njuguna, who's with us here at the coalition to start part of the program with sharing some results from our partner survey. Henry?
Thank you. Just a minute, let me share this. Great. Let me know if you are able to see the screens.
Yes, we can see, Henry. It's in the, you can see
okay,
both
great.
your upcoming slides.
Thank you very much. Good morning, good afternoon, good evening. Are you able to see the screen? Is it okay?
Yes, looks great.
Okay, perfect. Sorry. As I said, my name is Dr. Henry Njuguna, and I'm going to present to you the results of the survey we had asked partners to respond to prior to this meeting on their hepatitis B birth dose related projects in the African region. The objectives of this survey were to identify partners working on hepatitis B birth dose related projects in Africa, to describe the activities the partners were undertaking, to understand partner challenges and opportunities for hepatitis B birth dose implementation. As of yesterday, we had received a total of 17 survey respondents, and these represented about 15 organizations who responded to the survey. Of the 15 partner organizations, 12 had projects in 12 countries, some in multiple countries as shown in the slide. 2 had ongoing or planned projects in the entire continent, and one did not state the country they were working on. Among these countries with partner activities, 8 were reported to have action plans for hepatitis prevention and elimination. 2 did not, and in 3 countries, this information was not provided. One partner activity, on partner activities, it is important to note that some partners worked in more than one activity or project. So I'm going to highlight some of the major activities that were reported by the partners. More than 2/3 of the partners reported that they were involved in hepatitis birth dose planning, integration of hepatitis B birth dose vaccination, generating evidence on disease burden and on birth dose vaccination, training and improving coverage. More than 2/3 of the partners collaborated with government officials, clinicians, multinational organizations, and technical and research partners as shown in the slide. Partners, the respondents reported several challenges, and as we classify them, for the policy challenges, 53% of the respondents reported financial challenges. 41% reported lack of evidence to support introduction. 35% reported lack of national policy to guide the hepatitis B birth dose implementation. Among the programmatic challenges, 47% reported challenges in EPI and MCH, maternal child health integration. 41% reported challenges in cold chain and data systems to monitor and evaluate programs. For community and cultural challenges, 58% reported home births as being one of the main challenges. 29% reported cultural practices regarding newborn vaccination / access to newborn. And 24% reported vaccine hesitancy by parents or providers. Other challenges that were reported included low literacy about hepatitis B birth dose, community resources, clinician-patient relationship, vaccine access in remote facilities, and funding and competing priorities and some of the competing priorities were with other vaccines such as polio, and now, of course, COVID. And these are challenges that have also been echoed by Julian in his presentation. Other information that could be helpful in advancing progress in hepatitis B birth dose implementation, as reported by the respondent, included sensitizing community members about the importance of vaccination. One of the respondents also reported that it will be important to address the resistance to hepatitis B birth dose by health professionals, including pediatricians, who believe that birth dose is not a priority investment, since children are already receiving the pentavalent vaccine that included hepatitis B vaccine at 6 weeks. There is also need to increase demand by countries, highlighting that they are ready to move on with hepatitis B birth dose implementation and requesting support from Gavi and other donors. There's also need to develop a strong collaboration with the stakeholders. The planned future activities, as reported by the respondent, included more than a third reported plans to work on birth dose vaccination training and birth dose introduction planning. More than a quarter reported plans to work on integration of services of the expanded program of immunization and maternal child health services. A quarter reported plans to undertake data collection and epidemiological research. So I encourage you all who are partners in this particular meeting to complete the survey. There'll be a link sent in the chat box so that you can be able to complete this survey so that you can have as much data as possible to compile and share with the bigger audience for future reference. We also welcome the API managers too. There is a separate survey for you. So using the link provided, I'll encourage you to onto that survey. Thank you very much.
Thank you, Henry. Now getting some specific presentations, then we'll have a discussion. If we have the discussion questions, we wanted people to begin thinking about, perhaps we can put them up on the screen. That would be helpful. Then we'll turn it over. Of course, we're welcoming the robust chat that's already underway regarding questions and comments. So please keep that up. But just to seek to meet the objectives of the meeting, we really were interested in getting comments about what are the operational research and technical assistance needs that can help ministries of health and local partners introduce and scale up hepatitis B birth dose vaccination. As you hear what is already underway regarding research and technical assistance, how can the coalition and our partners, including those all of you on the call, work together to make these products of these activities more widely available. And then, how can, what kind of assistance specifically locally, such as working with the NITAGs and other key stakeholders to introduce hepatitis B vaccination? And what are the roles of the different stakeholders, particularly the role of civil society in mobilizing a commitment to hepatitis B birth dose introduction? Please be thinking about these questions as you hear these presentations today and tomorrow, and look forward to getting your thoughts specifically on these, in addition to the other questions and comments you have.